Telemedicine is fast becoming an effective remedy for medical woes, especially for Nigerians dissatisfied by the quality of healthcare in the country. Through telehealth platforms, patients now have access to medical services from the comfort of their homes, and according to the World Health Organization, it provides a cost-effective approach to delivering high-quality care and reducing overall morbidity and mortality. A few years ago, the regular sites at hospitals and clinics entailed congestions and long waiting hours to seek medical care from health professionals. But with the evolution of the healthcare industry and the advent of telemedicine, there has been a change to how patients access quality healthcare services.
Hello, doctor. Doctor, I'm not feeling fine at all.
Telemedicine has brought a new reality by providing a convenient way to receive medical support and bridge the gap between doctors and patients.
Telemedicine simply means the use of modern-day technology to provide clinical care to patients remotely. And it has been proven to be a very cost-effective and time-efficient solution in addressing the healthcare deficit across the globe. The technology itself is not new, it's been in existence for decades, but the adoption has been quite slow until COVID.
Telemedicine has been around for a while in many countries, but not so many accepted it until recently. Limited hospital visits in the wake of the COVID-19 pandemic facilitated its adoption as health workers were able to diagnose patients remotely via video and app-based visits.
Before the pandemic, a lot of people were quite skeptical about the use of telemedicine, especially professional bodies and a lot of older physicians and healthcare professionals. However, the tide is kind of changing with regards to the fact that people are coming to see that most of the clinic visits that we kind of go for endlessly can be cut out by using telemedicine.
So if it is itchy, we give something for the itchiness. The ketoconazole shampoo is not treating it as a fungal infection.
Although telemedical platforms are siblings to traditional healthcare systems, there are barriers to its implementation.
Across Africa, there's still no blueprint for the adoption of telemedicine, and that leaves a lot of loophole that needs to be urgently addressed. We need to have policies and guidelines that will guide, for instance, the licensing of the doctors, their qualification. Are they suitably qualified? You want to make sure that the doctors have the appropriate licensing and that they're currently in good standing with their regulators wherever they are practicing. You also want to make sure that the handling of the patient's medical record follows international guidelines and that they are not being compromised. So those are some of the things that need urgent attention.
Telehealth has its limitations, but the technology can play a significant role in easing up the strain on the healthcare system. Even though telemedicine is a game changer in providing medical consultation, it remains an alternative and not a replacement of the traditional healthcare systems.
One of the major things is that it serves to help us reduce costs. Beyond the cost savings, we also see that would help reduce the number of hospital visits, keeping the spaces in hospital for people that really need it, reducing the waiting times for other people. And then if we're looking at community-based care, for example, most care settings have a good connection between the hospital and the community, such that someone who is diabetic, for example, can be receiving care in a particular hospital, have a consultant based in the hospital, but also have a care team in the community. And those two people, in terms of the consultant and the care team in the community, would be able to liaise with video conferencing with the patients from time to time to help manage their conditions.
It reduces the time to diagnosis and treatment, so that means that there's less likelihood of a complication as a result of delayed presentation. So now patients can access a doctor quicker. They can get their medications delivered to their houses. They can get their diagnostic tests like blood test or even a swab taken from their homes. And then that reduces the hospital drop-in and the congestion that you have in the secondary and the tertiary centers.
Regardless of their geographical location, patients can access quality healthcare services from the comfort of their homes through telehealth, which is another way to show how much technology is revolutionizing sectors in the world.